Aki asked me to talk today about insurance and finances, and I think that was a little unfair to ask me to do that in 20 minutes because I could probably spend 2 days talking to you about everything I think you should know related to insurance and finances. But our goal is to give you some highlights about the things I think are most important for you to know related to insurance, and then to point you to where to go for more information that pertains to you specifically. So to start with, I want to talk to you a little bit about what Triage Cancer does as an organization so that you know where to go for that information. We are a national nonprofit that provides education on all of the practical and legal issues that come up as a result of a cancer diagnosis. And we do that through the hosting of free educational events across the country. And when I say across the country, I mean actually every single state, DC and Guam, we host in-person educational events. And then we also have online programs. So we have a free educational webinar series on a whole variety of topics. So the one that's coming up on November 20th is actually for caregivers. It's caring for caregivers. And then we have one that goes into an in-depth dive related to finances in December. But we also record them and have them available on our website at any time. So if you want more information related to Medicare, we have a webinar on Medicare on our website. We also provide educational materials on a variety of different topics, and I know that Aki has some of them here on the tables out in the room where lunch was, but they cover a variety of different topics, and then we also have state-specific resources that cover where you live. So I'm assuming everyone in the room today is from California? Any other states represented? But I know there's lots of people online too, right? So where you live actually matters in terms of what you have access to and where you're going for information. So we have those state-specific resources on our website, and we also have a chart of state laws. And those cover things like, what are your health insurance options, and what types of protections do you have as a consumer, and your ability to take time off work if you need to, or estate planning issues, or disability benefits. All of that information is broken down on our chart of state laws. And then we also know that not everybody learns in the same way, and sometimes insurance and finances and some of these topics are not the most interesting topics. So we have a series of animated videos that highlight some of the most important things that we want people to know, like how do you actually pick a health insurance plan with the lowest out-of-pocket costs, or how do you manage your side effects at work? So those videos are available on our website, and they're in English and Spanish, and then we also have some of them with Tagalog subtitles. And then we host an entirely separate website called cancerfinances.org, which provides education on topics that can impact your financial situation after a cancer diagnosis, and then connect you to financial assistance resources. But what's unique about this site is that you can go on and you can answer questions based on your situation, and then it will narrow down the information based on how you've answered those questions. So you get the information that's most relevant to you. Now, when we're talking about financial toxicity, that's kind of an odd term, but it was coined by some researchers in 2013 that really focused on how the financial burden of a cancer diagnosis can impact you beyond just the finances. It impacts your mental health and your emotional health, and can actually also impact your physical health as well. And even though financial toxicity is a relatively new term, the cost of cancer is not really a new problem. We've always had very expensive healthcare when it comes to a cancer diagnosis. And part of the reason we can't just fix financial toxicity is that there's lots of factors that contribute to it. So we certainly think that having adequate health insurance coverage is the most important way to minimize the financial burden of a cancer diagnosis, but there are lots of other factors. It could be about your employment situation, or your ability to take time off work, or your employer's policies, or do you have access to insurance coverage, or just what your financial situation was when you were diagnosed, can all be factors that contribute to financial toxicity. So you're not supposed to be able to read this, but this is a visual breakdown of all the different types of questions that someone would need to ask themselves and to find out about their situation to help avoid financial toxicity. And we actually have a quick guide on our website that poses all of these questions for you to think about, but also lists all the resources that we have that can help you figure out the answers to those questions. So that's on our website as well. Now, I often say that I don't think that there is one person who understands every aspect of our healthcare system, because it covers so many different industries and so many different professions and so many different agencies and laws and regulations that there isn't one person who can be an expert in all of it. So if you feel like you don't understand your own health insurance coverage, you are absolutely not alone. And it's now just not my opinion of that, but there's some data to back it up. So this is data based on employees who get their health insurance coverage from an employer, but they don't know what they're paying for their coverage. They don't know how to file claims. They don't understand what the terms are in their policy. And those are all important things to actually navigate insurance. So if you feel confused, you are absolutely not alone. There are some terms that we think are really important for people to understand. And I apologize that my slides have been reformatted so that they look a little funky. But anyone who would like a copy of the slides, I'm happy to email them to you. So if you email info@triagecancer.org, I will send you a copy of the slides. So there are costs that we pay just to have health insurance, and those are our monthly premiums. It's what we pay just to have coverage. Even if we got no medical care during the year, we'd still have to pay our monthly premium. But then there are costs that we pay when we get certain types of medical care. And the first is our annual deductible. It's what we have to pay out of pocket first before our health insurance coverage even kicks in. So you might have a $500 deductible or a $5,000 deductible, or if you have really good coverage, maybe you have a $0 deductible. The amounts are going to depend on the type of coverage that you have. But then there's something called a copayment, and this is something that you pay when you get certain types of care. So if you go in to visit your doctor, you might pay a $10 copayment. But if you want to see a specialist, you might pay a $30 copayment. Or if you go to the emergency room, you might have a $200 copayment. The amounts are going to depend on the type of coverage that you have. And a copayment is different from coinsurance or cost share. And the challenge in teaching health insurance is that everything has at least two names, just to make it super easy for us to navigate. So coinsurance and cost share mean the same thing, and it's a percentage. It's the difference between what insurance companies pay for our medical expenses and what we pay for our medical expenses. So if you have an 80-20 cost share, the insurance pays 80% and you're responsible for 20%. So you are literally sharing the cost of your medical expenses with your insurance company. But the most important thing that anyone should know about their health insurance coverage is their out-of-pocket maximum. Because in a worst-case scenario, it's the most that you're going to pay out of pocket during the year for your medical expenses. And you might have a $1,000 out-of-pocket maximum, or you could have a $20,000 out-of-pocket maximum, depending on the type of coverage that you have. So the way that you reach your out-of-pocket maximum is actually a math problem. So you get to add up what you pay for your deductible, plus any co-payments that you make during the year, plus any coinsurance amounts. And when you add those all up to get to your out-of-pocket maximum, then your insurance kicks in at 100% for the rest of the year. So you want to know what your out-of-pocket maximum is. So I'm going to give you an example of how this actually works. So David has been in the hospital for a week, and he walks out of the hospital with a $102,000 hospital bill. But he has a plan that has a $2,000 deductible. It's an 80-20 plan, and he has a $4,000 out-of-pocket maximum. So assuming he's had no other medical expenses during the year, how much does he actually have to pay of that $102,000 hospital bill? It's $4,000 because that's his out-of-pocket maximum, but this is how you get there. So first he has to pay his $2,000 deductible, which leaves $100,000 left of that bill. But he's got an 80-20 plan, so the insurance is going to pay 80% and he's responsible for 20%, which still leaves him with a $20,000 bill. But of that $20,000 bill, how much does he actually have to pay? It's $2,000 because he's already paid his $2,000 deductible, and then he pays another $2,000 of that $20,000 bill, and at that point he'll have paid $4,000 out of pocket, which means he's reached his out-of-pocket maximum, so the insurance is going to kick in and pick up the rest of that $20,000 bill. So I'm not suggesting that $4,000 isn't a lot of money, but it's better than the $20,000 bill he would have had to pay if there was no out-of-pocket maximum, or certainly the bill that he started out with. So there are a number of consumer protections that are important that are available under the law that have been really helpful for the cancer community specifically. So insurance companies are no longer allowed to cancel your policy when you try to use it, which sounds like something that would never happen, but was happening pretty frequently, and that's no longer allowed. Insurance companies can't impose annual or lifetime limits on benefits. So before the Affordable Care Act, we would see patients with a $75,000 annual limit or even a $1 million lifetime limit, and those aren't hard numbers to reach when we're talking about cancer care. And so now there's no longer allowed to be those limits. Young adults are allowed to stay on their parents' coverage until they turn 26. So even if that young adult is married, they can still stay on their parents' coverage because it's just based on age. And then the ACA also gave us access to free preventive services. So it's a specific list of services that are totally free to you. So you don't pay a copayment, you don't pay a coinsurance amount, and it doesn't get applied to your deductible. And they're all the things that you would expect to be covered in an annual checkup. There are also protections if you want to participate in a clinical trial where your insurance has to cover the routine costs, so all the things that would have been part of standard of care. And then the ACA also gives us protections as consumers when our insurance company denies coverage for our care. So when they say we're not going to cover a procedure or a surgery or a treatment or a drug, you can actually appeal that decision. And you get to go outside the insurance company to do that, to an independent review to make sure that you're getting access to care that your healthcare team thinks is medically necessary. But then the Affordable Care Act also did two things that were totally game-changing for the cancer community. It changed the way that insurance companies charge us for our health insurance coverage, and that process is called premium rating. So previously, insurance companies could look at whatever they wanted to when deciding how much to charge us for our coverage. And now they can only look at four things: whether or not you're buying a policy for an individual or a family, because if you're covering more people, they can charge you more; where you live, based on your zip code; your age, but they put a cap on how much more you can get charged as you get older; and then whether or not you use tobacco. And then California is one of the states that actually passed a state law that said we're not going to look at tobacco use at all. So what's missing from that list? Pre-existing medical conditions. What else? It applies to at least half the people in the room. Gender. Women have always been charged more than men for health insurance coverage, and that's no longer allowed under the ACA. So then the ACA went one step further and said, we're not going to let people be denied health insurance based on their pre-existing conditions, their age, their gender, where they live, or any other reason. If you can afford the policy, they have to provide it to you. So there have been a lot of proposed changes to our healthcare system over the last 2 years, but there's been a lot of conversation around protecting these pre-existing condition protections. But when they're talking about that, they're just talking about the second piece. But the second piece actually isn't a protection if it doesn't come with the first piece, because it doesn't mean I actually have access to a health insurance plan if you can charge me anything you want for it, because then you can price me out of the market. So then I don't actually have access to health insurance with a pre-existing condition. So when we talk about pre-existing condition protections, it really requires that both of these things come together. So I want to walk you through a quick exercise on how to actually pick a health insurance plan with the lowest costs. And this exercise actually works if you're comparing individual plans in the marketplace, like through Covered California. If you're comparing two different options that your employer provides you, you can compare your employer plan to a marketplace plan, or you can compare your Medicare options using the same exercise. So once you've narrowed down plan options, and for this individual, I've picked 3 different plans, and at the top, there is a bronze level plan that's $173 a month, but has a $6,000 deductible and a $6,000 out-of-pocket maximum. And then I picked a silver level plan in the middle, which is like another $100 a month, but has a $2,500 deductible and a $5,200 out-of-pocket maximum. And then I picked the most expensive platinum level plan for this individual that has another $120 a month in premium, but has a $0 deductible and an $1,150 out-of-pocket maximum. So can you tell just by looking at these options which plan actually is cheapest, assuming that you're going to hit your out-of-pocket maximum during the year? Because when we're talking about cancer care, the chances of that is pretty high. Can you tell just by looking at them? It's not a trick question. It says you have to do the math. So the way that you do the math is you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum, which is how much you're going to pay out of pocket for your medical expenses during the year. So then which plan ends up being cheapest? In this case, it's the platinum level plan. But we look at that monthly premium and we get sticker shock because it's higher, but because we don't generally understand how the out-of-pocket maximum works, that's not usually how we shop for insurance. And so when you're looking to lower your out-of-pocket costs, in this case, doing the math could save you a couple $1,000s, even though that monthly premium seems so much lower. So this is the key way to keep your out-of-pocket costs as low as possible. But it's not just about cost. You also have to make sure that whatever plan you're looking at actually covers your providers and the prescription drugs that you're taking, because otherwise it's pretty useless to you if it doesn't cover these things. So before the Affordable Care Act, we would get health insurance. Maybe we got it through an employer or we got an individual plan. And then if we got diagnosed with a serious medical condition, we would hold on to that health insurance coverage for as long as we could, because we couldn't go buy a new plan. Now we have options every single year to make changes to that coverage. So every single year, whether or not you get coverage through an employer or through the marketplace or through Medicare, you should be doing the math on your plan choices to see if there's a way to lower your out-of-pocket costs, which is something that we didn't have access to before. So we have a huge number of resources related to health insurance on our website. So if you go to triagecancer.org/health insurance, there are videos and webinars that go into greater detail about different types of health insurance options, as well as a number of other resources. We also have a partnership with Needy Meds that provides a drug discount card. And this is something that you would take to the pharmacy, and if you went to the pharmacy and you were given a prescription drug and they said that your copayment was really high, you could ask the pharmacist, well, tell me what my copayment would be with my insurance, but tell me what my copay would be using a drug discount card instead. And something around 80% of the time, it's actually lower using a drug discount card, obviously dependent on how good your coverage is. But I actually just think it's a useful tool just to remind you to ask the question, because pharmacists aren't going to offer up, by the way, I saw that your copayment was really high, but if you use this drug discount card, it would be cheaper. But if you ask the question, they might have multiple different options that could lower your copayments for prescription drugs at the pharmacy. So it's good just to ask the question. Switching from health insurance to disability insurance for just a minute, there are lots of different types of disability insurance which replace your wages if you need to take time off work. And there's lots of different forms of disability insurance. So it might be private insurance coverage that you buy directly from an insurance company, or it might be something that you get as an employee benefit. So it's like the health insurance that your employer offers you. I can't tell you the number of people who have told me, oh, I don't have that, and I sent them back to their employee manual, and it turns out that they do have coverage because it's just a piece of paper you sign on your first day of work, and the employer pays the premium, and so you kind of forget all about it. So it's good to double check to see if this is something that you have access to if you need it. There are also a handful of states, and California is one of them, which provides state disability insurance, where if you need to take time off work, you can get access to a short-term disability plan. And the definition of disability in California for this program is very low. So even if you had a serious flu that kept you out of work for 2 weeks, this is a program that you could actually access. So it's very useful, and again, there's only 5 states in Puerto Rico that actually offer this coverage. And then there are the 2 federal long-term disability programs that are run through the Social Security Administration. There's Social Security Disability Insurance, and there's Supplemental Security Income. And we have a huge number of resources related to disability insurance. But if you did need to take time off work, we have a recorded webinar on our website called Taking Time Off and Paying for It, which talks through some of the employment protections under the FMLA and the ADA, and then talks through how to actually apply for disability insurance. So this is also available on our website on our employment and our disability insurance resource pages. So with that, I will take some questions if you have any. Yes? Do you want to give her this one?
Quick question. Long-term disability, employer, extended benefits. Is it true that at the 24-month mark from the start of SSDI, you can apply to Medicare no matter your age? And if so, then maybe supplement that with, extra insurance, or how does it work? Meaning at some point, I'm going to be cut off in December of next year, so I'm already starting to think that through.
So there are actually 4 ways to qualify for Medicare. You either are 65 and older and eligible for Social Security retirement benefits. You've been receiving Social Security disability insurance benefits for 2 full years, and then you automatically qualify for Medicare, so you don't actually have to apply for it. And then if you have end-stage renal disease or ALS, those are medical conditions that automatically qualify you. So we actually have a resource on our website that explains the timing of your SSDI benefits and when your Medicare will actually begin, because it's not actually 2 years. Because with SSDI, you have a 5-month waiting period where you have to wait for their benefits to actually begin. So it actually takes 29 months for your Medicare to actually start.
That's the source of the confusion. When you go to the cancer center, the social workers quote the 24, the 29, and it's very confusing. I don't think they understand it themselves.
Yeah, it's actually incredibly complicated. It's why it's a lot of math, and you have to figure out when you first become entitled to cash benefits. So it's your entitlement date for Social Security disability. And then it's 2 years from your entitlement date.
So it's not 2 years from the first payment.
It's not when you receive the first payment, but it's when you're first eligible to receive the first payment. Because it could take you years to get your first payment. Because if the application process takes a long time, and then you could get denied, and if you go through the appeals process, that actually could take 2 to 3 years for some people. And so you might be owed a lot of back benefits. So it's not necessarily when you receive your first check, it's when your entitlement date is. And that resource is called the Quick Guide to Timing of SSDI and Medicare.
Okay. Well, I do recommend anybody in my situation to look into that.
Yes. And you can have supplemental coverage to Medicare. If it's an employer plan or COBRA, you can have additional coverage. Of course. Any other questions? Oh. Okay, thank you.